Nothing ever stayed the same. Want to let it change.
Hi, I'm Lou and welcome to my channel. Today we're going to be looking at what's going on in your second trimester, some tips and tricks in surviving some of these symptoms, and my own personal experience and stories about my own second trimester time. So let's dive in. So usually second trimester kicks in roughly around about 13 weeks or 14 weeks. However, for mine, my symptoms for the second trimester didn't really kick in until about 16 weeks. So my first trimester nausea lasted from week 4 to week 16. So I was nauseous for 12 weeks and throwing up in that time frame. But as soon as 16 weeks happened, my nausea decreased to the point where it was nothing. That might happen for you. Yours might happen earlier, yours might happen later, or not at all. For those that doesn't happen not at all, I am sorry that you had experienced that all during your pregnancy. But once my nausea dissipated, I was hungry, guys. I was able to keep food down and it was good. And with that came my cravings. So some of the foods that I craved was salads, McDonald's, Australian food, and oddly enough, mandarins. Like not oranges, not grapefruit, not any of the other citrus, just mandarins. I would eat like 3 mandarins before dinner, a mandarin at dinner, and 3 mandarins after dinner. I was mandarin crazy. Like I bought like 2 bags, like 1-pound bags of mandarins to hopefully survive through the week, and sometimes it didn't. So just so you know, I don't really eat mandarins anymore. It was just during that second trimester mainly. So you might be experiencing some odd cravings, or your hunger or your appetite might increase because of your nausea decreasing. And with that, appetite and hunger and eating usually comes with weight gain. And weight gain is perfectly normal, guys. Pregnancies, you have to gain weight anyways. It's to help the baby grow, it gets their nutrients, and not only that, but also helps with milk production afterwards. Now, please, if you're worried about weight gaining or not gaining weight, please talk to your doctor in regards to that, and they'll be able to give you some very personal advice on how to move forward with the nutrition journey for your pregnancy. Okay, but I started gaining weight. I had that pregnancy glow in my skin, and with that came the baby bump. I didn't really show until about 16 odd weeks, but it was so lovely just to look in the mirror and go, oh yes, there's my little one. It was absolutely wonderful, and you might be over the moon as well seeing that little bump. Now, with that bump, roughly around about 20 weeks, I had an ultrasound. And at that ultrasound, I was looking at it. The ultrasound technician was doing her thing. And next minute, I see that my little baby go boop, boop with her legs. Oh, I should say boop, boop, boop like this with her legs. And I could feel it. And all of a sudden, I was like, oh, that's what it is. And the technician turned to me and was like, what? I'm like, that she was kicking. I could feel it. That's what that feeling is. And she's like, yep. And I'm like, I've been feeling that for the past 2 weeks. And she's like, good. So some people describe feeling baby move as in like having butterflies in your stomach or your stomach twisting and turning. Sometimes for me, it felt like there was an alien in there, but it's all unique. But once you feel it and once you recognize that that is your baby moving, it's one of the best feelings in the world. Until you get into your 3rd trimester and then it's a little bit more rough. But feeling those little kicks and the little turns, it's a beautiful feeling. And so, it makes it really real too, thinking about it, feeling her. It's solidified. You're having a baby. So, just to recap, second trimester usually hits around 13, 14 weeks. You're starting to show, your cravings are starting to increase. With that comes weight gain, and you should be feeling some movement from baby. If you have any questions on that, I suggest to direct them towards your doctor, as again, they will be able to provide you with better advice than someone like myself that just has her own experience and no medical training. All right, so you're feeling movement. Now comes with telling people. You can tell people in your first trimester if you want to. I did not. I waited till about 14 odd weeks and then started telling people outside of my immediate family. That's just what I did. Everyone does their own thing. You can do like a full-on gender reveal, because usually around 20 weeks you can find out what the gender is through an ultrasound if you didn't do the genetic test in your first trimester. So you can do that. Honestly, I'm not very show and telly, which is funny because I started a YouTube channel, but I'm not really, too show and telly in regards to what's going on in my own personal life using social media. So, but that's up to you. You can start telling people, because you're starting to show, the risk of miscarriage has severely decreased by this point in time. And if you have any doubts, ask your doctor. All right, so with that starting to show, ladies, you're going to have to start sleeping on your side. I know it doesn't sound like a big deal, but to a front sleeper, it was hard, because not only was I waking up every few hours to go to the bathroom, I was also I had to try and figure out how to stay on my side. I like sleeping on my front. It's just how I like to sleep. So I had to try and train my body to sleep on my side. So I would use a pillow to try and spoon to try to prevent me from rolling onto my stomach, which didn't always help. Sometimes I'd wake up and I was on my stomach. So you can use a pregnancy pillow if you want to. I just use a spare pillow that we had, and that worked perfectly fine. However, with that, I also had some heartburn, and it was really bad at nighttime, mainly because you're lying flat. So your stomach, gravity is amazing, guys. So there's less gravity, so there's more heartburn. So what they recommend is having a wedge pillow. I had one. Not only was I trying to sleep on my side, but now I had to sleep on an angle. And guys, I like sleeping completely flat. If I had the chance, I wouldn't even use a bed. I would just sleep on the floor with my pillow that's this high. That's me. My husband's a different story though. But I like completely flat. So I had to learn to sleep on my side on a wedge pillow, trying to spoon a pillow so I wouldn't roll over on my back or on my front. Now, the reason why we sleep on our side is to reduce the pressure that's on our back as well as on the front. It's like the perfect position for baby to develop and grow, and it's also the perfect position for your body to continue in an optimal way. So, yeah, there's that. Sleeping on your side. I also had some congestion, okay? With the increase in blood that your body is creating to help sustain the baby as well, this can open up and make more mucus in your nose, so you might feel congested, okay? Best tip for that is grab some eucalyptus essential oil, put in 5 drops in the bottom of your shower, and then when you're ready to shower, it's all eucalyptusy and it helps open up your nose, and then you feel good, real good. You can start to breathe again. So there's a tip there for you in regards to some congestion. Now, I also had massive leg cramps. Almost every other day, I would wake up with a Charlie horse in my calf muscle. It was so bad. It's like a catch-22. You want to move your leg because it's good, because it will help, that muscle stop spasming. but then it's bad because it hurts. Unfortunately, I woke up my husband several times during that second and third trimester because of my leg cramps. So you may experience some leg cramping. Best thing to do is if you do get Charlie horses, just try to massage them out as best as you can, walk around a little bit, and then it should go away. I don't have any other tips for that. Now, once you start to show your balance, so your body's natural balance starts to shift, okay? And with that can come achy feet. It can also come with some ankle issues as well as some lower back pain. Okay, again, it's because you're literally growing someone in your stomach, and that puts off your center of gravity and your balance. So you might actually fall and trip over. If you do fall, please contact your doctor immediately, because you want to make sure the baby's okay. No matter if it's a light fall or a heavy fall. Okay, you just never know what might happen. And so it's always best to be safe than sorry. So with that center of gravity shifting, you're off balance, which then causes some issues in your feet, legs, as well as your lower back. Now, if you have some pain in your lower back, what I found really, really nice was having just some warm water as I was showering, just to run it down my back. That was really, really nice. You can also put some deep blue doTERRA muscle rub also on your back and on your calf muscles if your legs are hurting there. And just pamper yourself, ladies. Your body's going through a lot right now. So pamper yourself. If your feet hurt, take a break. Put your feet up, relax. Give yourself about 10 minutes, then keep going on your way. Don't expect too much from yourself, because your body is already working so hard without you adding more stress to it. Okay, so those are the main second trimester symptoms and experiences that I had. Yours might be different. There is a lot more that can happen during your second trimester. So if you want to have a look more into it, I suggest looking it up. But yeah, that is what I experienced. If you found this video helpful or interesting, entertaining, you liked it, please give it a like and please subscribe to my channel, as there will be more videos based on this kind of overall topic. But other than that, I hope you have a wonderful day or night, depending on what time you're watching this, and that you are kind and courteous to others as you are going along your path and your journey. But I will see you in the next video. Bye.